Welcome to the lecture today on depression, anxiety, anger, and chronic pain. In the lecture today, we'll cover the definitions of what these terms are and how chronic pain impacts these different emotions. Towards the end of the lecture, we'll look at treatment options, some self-help strategies, and other resources that are available. But first, what is chronic pain? What do we mean when we use the word chronic pain? The word chronic comes from the Latin word chronos and means long-term. So in the context of chronic pain, we're talking about pain that's lasting beyond the normal time of healing. Often this is clinically defined as 3 months or longer. We distinguish that from acute pain. Acute pain meaning short-term pain. So if I go out this afternoon and break my arm and it's in a cast for about a month or so, and then it comes out of the cast and I do some exercising and it heals again, that's acute pain, short-term pain, different from the long-term nature of chronic pain. Usually chronic pain cannot be cured or fixed. It's like cancer or the common cold. There's some treatments, but the common cold returns and sometimes cancer returns too. So there's research and there's lots of progress being made, but usually chronic pain at the present moment can't be fixed or cured. What we know from the research is that chronic pain is best helped with a partnership with a multidisciplinary team that's comprised of individuals with many different disciplines involved, and we're all collaborating together. Chronic pain can certainly affect people's lives in many different ways. And here are some of the ways that chronic pain may have affected you. First of all, loss of work or activity that you may have been doing. That can mean loss of work or part-time work now, and as a result having less money and maybe more financial worry. You may rely on other people more than you used to, so you feel less independent, and maybe there's been some role changes so that you're not doing the same roles that you used to do and other people are taking on some of the roles that you did. In terms of activities around the house or around the yard, your day-to-day activities, you may have more difficulty doing those things with chronic pain. And in terms of hobbies or activities that you enjoy doing, chronic pain may result in you not enjoying those activities as much or having to change the way you do them. So if you like to golf, maybe now you're taking a cart around the course when before you used to walk. So you're having to adapt and do activities differently. Some of the other impacts of chronic pain can include medication side effects. So for some people, they may experience side effects including constipation, maybe weight gain, maybe fuzziness in your head with some of the medications. Chronic pain can also impact social activity, so that now with chronic pain, you may be going out less. It may take a whole lot longer just to get ready to go out. So you may be feeling a bit more isolated and doing things more on your own. And overall decreased physical ability, and maybe having to pace yourself through activities in a way that you didn't have to do before. All of these potential changes with chronic pain can make chronic pain difficult to cope with, and sometimes it can lead to some negative thoughts and feelings like depression, anxiety, and frustration and anger. It can also lead to a downward spiral or a vicious circle where pain becomes the center and focus of life. So as you can see with the diagram, starting on the left-hand side, when chronic pain starts, one way of coping may be to rest, take it easy. You may have learned that from acute pain, that you're not supposed to do too much activity. You're supposed to just rest and not do too much. Or you may rest because you're afraid of re-injuring yourself if you do too much activity. And when you start doing that, limiting activities, that has an impact on the body in terms of muscles becoming weaker, more tight. And as your muscles in your body change and become less functional, you may be doing less activity and not wanting to go out as much with people. So you're doing fewer social activities. And not having as much contact with people can affect mood. So you may be feeling more depressed or anxious or more angry. We know that with depression, there can be less initiative. You may not have the motivation to do things, and that just contributes to not doing activity, and the whole cycle continues to spiral. A lot of people wonder, what is the relationship between all these emotional factors and chronic pain? Well, from the research, we know that there's no good, consistent evidence that shows that psychological problems cause chronic pain. What we do know is that depression, anxiety, anger can develop in response to chronic pain. And in fact, in depression, we use the term reactive depression when we're talking about depression that develops in response to some kind of an event. So the impact of these emotions on chronic pain are that they can contribute to having pain flare-ups and having increased pain. And it can make it even more difficult to cope with chronic pain itself when there's these other emotions going on. At the Chronic Pain Center, we've done some research looking at depression and anxiety in people that are coming into the center. So we give them questionnaires when they first come in to the center, and we ask them to fill them out, and we get an indication of their level of depression and anxiety. What we found in one of our studies is that about 40% of people are moderately or severely depressed before they start treatment at the Chronic Pain Center. That breaks down into 24% moderately depressed and 16% severely depressed. In terms of anxiety or worrisome thoughts related to pain, that research has shown that about 13.5% of people starting the program at the Pain Center have these anxious thoughts that are specific to the pain. Let's look first at what depression is. How do we distinguish it from just a low mood or having an off day? A clinical level of depression isn't simply feeling sad. In fact, there are several criteria that have to be met before a diagnosis of a clinical depression can be made. And in fact, there are 9 possible symptoms of depression. To get a clinical diagnosis that we call a major depressive episode, a person has to have 5 or more of the 9 symptoms. The symptoms must occur nearly every day for at least 2 weeks. So to make that diagnosis, a person has to have a low, depressed mood most of the day for at least 2 weeks. And or a lack of interest in activities that they previously used to enjoy. So it's a change. They used to really like doing certain things, and now they don't have the interest in them anymore. And they've lost pleasure in those activities most of the day. In addition to that, there are 3 or 4 of the following symptoms that have to occur to have a clinical depression. Change in appetite. That can be where you're eating more or eating less than you used to, with potentially weight loss or weight gain. Difficulty sleeping. That can be either insomnia, not getting enough sleep and feeling exhausted, or sleeping too much, hypersomnia, and that's not usual for the person. Physical agitation or a slowing down in behavior that would be recognized by other people. So what we mean by that is maybe you're pacing more than you usually would, or your behavior is a lot slower and other people notice that you're slowed down. Fatigue or loss of energy, feeling worthless or guilty. And so for some people that's thoughts about I should have done something or I shouldn't have. Shoulds, lots of shoulds in our heads can lead to feelings of guilt. Difficulty making decisions or being able to concentrate on something. So people describe it's hard to stay focused on a book. For example, they used to love reading and it was easy to do, and now they lose sight of where they're at in the book. They can't follow the plot as easily. And last, repeated thoughts of suicide with or without a suicide plan. And that gets at the hopelessness, just feeling so hopeless that the future just looks so dim.